Welcome and thank you for joining us today. My name is Jenny Denford and my current role is Project Grow Intellectual Disability Navigator here at the Central and Eastern Sydney PHN. Also joining me is Hannah Coffey, Intellectual Disability Coordinator from the Project Grow team. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognise their continuing connection to land, water and community and pay respect to elders past, present and emerging. I also extend that respect to any Aboriginal colleagues who may be joining us today. I'm joining this webinar from Dharawal land. I would also like to acknowledge people with lived experience of disability along with their carers and all those in the sector that support them. Please note, this webinar will be recorded on a YouTube link and that will be available within the next couple of days. At the end of the webinar, for the purposes of reporting, there will be two surveys. Down Syndrome Australia will show a QR code that will take you to a brief survey, and a link to CESPN's evaluation survey will pop up on your screens in your web browser. We appreciate your feedback. Please complete this to allow us to issue certificates of attendance. Please ensure that you submit your questions to the speakers in the Q&A function throughout the presentation. To view, hover over the toolbar at the bottom of your screen. For upcoming CPD events, webinars, please register via the CESPN website. I would like to remind you the coronavirus page on the CESPN website contains links and resources to support general practice, including all the latest updates. Today's education event has been coordinated by CESPN's Project Grow team. The Grow Project Navigators are available for practice visits within the CESPN region, providing tailored support and education to clinicians, administration staff around all things intellectual disability. This includes supporting practices, implement reasonable adjustments, promoting update of annual assessments, as well as a range of tools and resources to support clinical care for patients with intellectual disability. Details on how to get in touch with our project navigators will be provided in the follow-up email. I would like to now introduce presentation, inclusive communication, improving health outcomes for people with Down Syndrome Australia. Over to you, Rowan, Olivia and Natalie.
Thank you. And to start our presentation, I will share my screen. Just checking, can everyone see that slide?
That's great. Thanks, Natalie.
Terrific. Over to you, Ro.
Hello, everyone, and thank you for coming to listen to our presentation. Inclusive communication, improving health outcomes for people with Down syndrome, and hopefully all people with intellectual disabilities.
Firstly, we would like to acknowledge the Aboriginal lands in which we are all meeting on today. We want to pay our respects to elders past, present and emerging. Hi, my name is Olivia Sue and I am a massive fan of the South Sydney Rabbitohs. And I go to many home games as possible. I love doing dancing, traveling and fashion. I am a health ambassador for DSA and I work at SOP Architects. And my jobs keeps me busy.
Hi, my name is Rohan Bulwood. I live in an apartment on my own. I like to travel. I work in Mexico for 18 years, and now I'm a health ambassador for Down syndrome Australia. I am proud of the work I do.
And a virtual hello to everyone online today. And thank you, Central and Eastern Sydney PHN, for hosting this Lunch and Learn webinar. My name is Natalie Graham, and I am the Health Program Manager at Down Syndrome Australia. I'm a registered nurse and still practicing. I have a Master's in Public Health, and I am the mother of 4 girls. My third daughter, Henrietta, whose photo that is there, was born 18 years ago, and she has Down syndrome. So this is my ideal job, combining all of my worlds. As you can see, Rowan and Olivia are like most of us here today, with jobs and hobbies, and are participating members in their community.
Today, we want to teach you how to include people with Down syndrome in their own health conversations. We will look at why this is important. Here are experiences when visiting health professionals.
We will talk a little bit about Down syndrome, and we will examine effective inclusive communication and how we can all work together to achieve it.
So firstly, as Olivia said, we wanted to look at why it is important to change the status quo of health for people with intellectual disability in Australia. The National Roadmap for Improving the Health of People with Intellectual Disability was launched in August last year. Some of you may be familiar with what we call the Roadmap. It outlines the need for intellectual disability healthcare reform in Australia and the road to take us there. The Roadmap is a 10-year plan, and we are very proud to say that the Down Syndrome Australia Health Ambassadors Program is featured on page 8 as an example of navigators to help guide and support health professionals, which is what Olivia and Rowan are here doing today.
The roadmap has a strong focus on strengthening the communication between health professionals and people with intellectual disability.
Here are some of the appalling statistics in intellectual disability health as identified in the roadmap. People with intellectual disability have twice the rate of avoidable deaths than the general population. People with intellectual disability have significantly higher rates of physical and mental health conditions. And standardised preventative healthcare measures are not utilised as they are with the general population for people with intellectual disability.
The average medical degree is only 2.6 hours in training in intellectual disability.
There is also a need to influence positive change in attitudes. We can see here a brief summary of the first national survey of community attitudes towards people with disability. Over 2,000 people were surveyed and 78% said they were unsure about how to act towards people with disability. They felt that it was due to a lack of familiarity, a lack of experience, and preconceived stereotyping.
There are many codes and rules that say people with disability should be included in their own health. And this is one of the codes for doctors in Australia. Good communication will support you to work in partnership with your patients.
The UN Conventions on the Rights of Persons with Disabilities also says that we have the right to good health and should be included in our own health outcomes.
National and international bodies see the need for change in practice. Research shows the need for change in attitudes. So now let's look at what people with Down syndrome want. In 2020, Down Syndrome Australia surveyed people with Down syndrome about their experiences and what they would like to tell health professionals when they are caring for someone with Down syndrome. This is what they said.
Take time with your patients, include me in the conversation, speak to me, not my support person, and speak slowly.
Use a language that I use and understand. Use supports to help me understand. Don't treat me as Down syndrome.
So at this point, we'll have a little brief look at Down syndrome, as Rowan said earlier. Down syndrome is the most common form of genetic intellectual disability.
We are people, not a diagnosis. We are more alike than our families than each other. We have our own personalities and potential. We all have an intellectual disability, but this does not stop us from learning.
We have the right to go to school with all our peers, have a job and be paid, be an active part of our own health, and be supported to do all this.
How does Down syndrome occur? Down syndrome occurs at conception and does not discriminate between age, geography, or background. There are approximately 15,000 people in Australia who have Down syndrome and about 270 births each year. There are 3 types of Down syndrome: free trisomy 21, translocation, and mosaic Down syndrome, which approximately 2% of all people with Down syndrome have mosaic Down syndrome. When you meet or care for someone with Down syndrome, it's important to look at the person. Don't associate everything about them to Down syndrome. That is to say, avoid diagnostic overshadowing. Some health professionals assume behaviour and health issues relate to Down syndrome and fail to fully explore the cause of the presenting symptoms. People with Down syndrome have higher incidence of some medical issues. However, with appropriate population screening and annual health checks, many of these conditions can be mitigated. And remember that people with Down syndrome should be part of their own health outcomes. Encourage your patients to keep a health diary so that they can be independent in their knowledge of their own health, something like the My Health Matters folder, which is up on the screen. Down Syndrome Australia has also produced this useful guide, health screening tool for people with Down syndrome, birth to adult, that can be found on the Down Syndrome Australia website under health, which lists some of the more prevalent co-occurring health conditions and preventative measures and treatments that can be taken. It's divided into age groups for ease of use. When communicating with anyone with Down syndrome, set the person up for success.
People with Down syndrome have some common traits, and then of course everyone has their own individual strengths. Just because you may not understand me doesn't mean that I don't understand you.
People with Down syndrome are better visual learners. Everyone has their own individual strengths. You need to take the time to find them.
And the use of appropriate language is also very important when talking to or about people with disability. It sets your colleagues up with the right attitudes and manner.
Is person first language? He or she is a person with Down syndrome, not a Down syndrome person. Down syndrome is a syndrome, not a disease.
I do not suffer from Down syndrome. It's just a part of who I am. Call us by our name, and not a short form of Down syndrome or other words. Don't use words like normal. Use typically developing.
And just as clinicians in Australia, Down syndrome is preferred spelling without the apostrophe S, because although Langdon Down discovered the syndrome, he doesn't own it. And we'd like you to watch this video to show you how words matter and for you to reflect on your own practice when talking about or to people with Down syndrome.
People with Down syndrome have special needs. Special needs? Really? It would be special if people with Down syndrome needed to eat dinosaur eggs. That would be special.
One dinosaur egg. Enjoy.
If we need to wear a giant suit of armor, that would be special.
I got a condo in Manhattan. Baby girl, what's happening? So don't get to clapping. Go pop a phone.
It would be special if we needed to be massaged by a cat. If we needed to be woken up by celebrity.
Wakey, wakey, eggs and bakey. Where are you? You may know me from Scrubs or Office Space. Your darker flicks, The Rock, Platoon, Wall Street. Funny story, I played Bets.
Out.
My bad.
That would be special. But what we really need is education, jobs, and opportunities, friends, and some love. Just like everybody else. Are these needs special?
So effective, inclusive communication is the how we can achieve better outcomes for people with Down syndrome and more broadly, hopefully, intellectual disability. And the how people with Down syndrome can be included in their own health and have a better health outcome and experience. Effective, inclusive communication decreases anxiety and pain and increases understanding, which results in an increased knowledge and therefore better health outcomes. Now let's look at what effective, inclusive communication is. I know that most of you will already have been taught this, but it's always really good to have a refresher and a reminder.
There are 5 key areas of communication: a verbal communication, and non-verbal communication.
Non-verbal communication includes both technical and non-technical communication. This can be as simple as a smile and a gesture, the use of formalised non-verbal communication techniques such as keyword sign, or as technical as computer software. It's a matter of using the communication form that the person uses and is used to.
Active listening.
Listening and understanding what the person is communicating and what they mean, giving them the time to communicate what they mean.
Checking in.
Checking that the person fully understands what you are saying to them. and not just nodding their head.
Create a relationship of trust and respect.
There are many barriers to effective communication in healthcare settings.
Physical barriers.
Hospitals and surgeries are very noisy, busy places. And now that masks and shields are in use, it's another added physical barrier. People cannot see you smile and they can't hear what you're saying.
Social barriers.
Speaking in a manner that's appropriate for the person's age and a manner that they can understand.
Psychological barriers.
Many people with intellectual disability and Down syndrome have had a negative or traumatic past experience in health. Check to see if that person is anxious or stressed and what you can do to relieve that stress or anxiety. Most people with Down syndrome will have a really good idea or tip on what they can tell you about themselves that helps them relieve their anxiety or stress. And reasonable adjustments. Let's have a look at reasonable adjustments that health professionals can make towards inclusion.
Give us time, give us support, use a language that we understand, and use visual aids to help us understand.
Use plain language and words we can understand. Speak to us and not our support person. Break the information down so it is easier to understand.
And this diagram is about checking in and making sure the person understands, making reasonable adjustments to your communication styles to ensure that they understand. And importantly, when you think that the person has understood, ask them to tell you or communicate it to you in their own way so that you know that they have understood. Understanding creates knowledge, inclusion, and independence.
Yeah, we would like you to listen to my lived experience in health as a person with Down syndrome. I have chosen to use a video on my speech that we recorded in March last year. Here it is. Good morning, everyone. My name is Raheem. I'm a health ambassador for Down syndrome in New South Wales. I am 42 years old and I live in 2 different states and 4 different cities. I have seen a lot of health practitioners. Some are easy to understand, some are not so easy to understand. Today, I would like to talk about when it is hard to understand what the doctors are talking about. Some doctors can have an accent or picture pass or use words that I do not understand. This is important that doctors check that people understand what they told them. This will help everyone, especially with people with disability, to get the right information and do the right thing. Sometimes my doctor is hard to understand and I'm not sure what she's talking about. This means that I always have to go to the doctors with my mother or father. I am 42 years old and live by myself. I don't want to take my parents with me and don't think I should have to. One time, we asked my doctor to send us a text message to explain what was wrong and what prescription I needed. This had worked really well. because we all know the right answer to any questions. And now I can judge it to Dr. for myself and be sure that I understand everything too. I really like to be independent. Some people like to check so they understand, explain the information back to the doctor. Other people like to write down. Sometimes I write the information as an SMS on my phone, and share it with other people. Everything is different, and healthcare workers need to know what works for your patients. Checking the information is right will help people to make a good decision for themselves. So I want to remind doctors to speak freely, to not use words they don't understand, and make sure that your patients know what you are saying. Thank you.
Thanks, Ro. And as you can see, Rowan's doctor made a small, reasonable adjustment and used an alternative communication style, which gave Rowan the independence and inclusion in his own health and his own health outcomes.
Good morning.
Reasonable adjustments can also be made to the way a health professional interacts with someone with Down syndrome.
Remember, be respectful, be kind, be clear, be honest, and listen.
Communication is also about body language, peace and tone, and don't forget a small goes a long way.
And now we would like you to listen to my lived experiences in health as a person with Down syndrome.
Today I'll be talking to you about including people with Down syndrome in the conversations about our health and helping us feel more supported. People with Down syndrome experience all the same emotions as everyone else and should be a part of their own health decisions. By including us in this conversation, you will get the right information about us. And my favorite quote is from Cinderella. Have courage and be kind. Healthcare workers can be better at the job if they listen and be kind and always respect others. And make it simple so we can understand, and we will have the courage to tell you how we feel. When I was younger, I couldn't get out my words out, and I stuttered along the way. I needed to improve on my conversation skills, and I realized that I needed help. And my speech pathologist was Erin, and she helped me to slow down the words. She always made me feel so important so I could get my message across. She is kind and bubbly and helped me. It is important for doctors and healthcare workers to speak directly in simple terms and ask simple questions.
It is important for doctors and healthcare workers to be kind and include us in the conversation. When you do this, we will be able to understand what you are doing and what you want us to do. This enables you to treat us and look after us better.
As you heard, Olivia's speech therapist created a rapport, treated her with respect and gave her confidence.
We would like you to go away with some helpful tips that can make a difference to the health outcomes of people with Down syndrome. Remove the attitude barriers towards people with disability.
Alignment and effective inclusive communication methods. Reasonable judgment make a difference.
And the bottom line is, treat others the way you would like to be treated. Olivia, Rowan and I hope that you've learnt more about why there is a need to improve the health outcomes for people with intellectual disability, what people with Down syndrome would like health professionals to do, a little bit about Down syndrome, different communication styles and appropriate language, and what achieving inclusive communication is and what some of the barriers towards achieving those goals are. And most importantly, what small reasonable adjustments you can make in your practice that can make a huge difference to the health outcomes of someone with Down syndrome.
Here are some links to two websites that we think are helpful. Down Syndrome Australia, Council for Intellectual Disabilities, the National Roadmap.
I thank you for listening to us today. We would really like your feedback, so please send me QR code to get to our evaluation. Does anyone have any questions?
We don't have any questions as yet, Rowan, but we do have a mention from Julian, one of our allied health professionals, around the health screening tool. And I did reply back to Julian saying that, you know, that's on the top of the list for our navigators when we're talking to GPs and allied health providers around the annual health assessment 701, 3, 5 and 7. That's on our top of our list to promote to health providers. Are there any questions that we have in the audience?
Would you like me to stop sharing my screen now? Would that?
That would be okay. Yeah.
Yep. Okay. I think everyone's had enough time to fill out QR. So I'll stop sharing.
Thank you to Rowan and Olivia and Natalie for your informative presentations, how communication matters, highlighting the importance of inclusion that can include extra time being included in the conversation, speaking to you and not your support person, being part of all decisions that affect you, and a reminder about reasonable adjustments to help you feel more supported and that can make a huge difference to your health care. I'd like to thank all the attendees for joining us today, and a reminder to complete the online evaluation survey that will pop up in your web browser. Thank you very much again, Rowan, Olivia and Natalie. It was a fantastic presentation today. And we look forward to seeing everybody again online soon. Thank you. Bye for now.
Thank you.